Yes, what was the sort of single moment that one could imagine was an influence in one's life, and a big influence? And that was when my granny was quite convinced that I was going to make a physician. I wasn't certain myself, because I had lots of other ideas. But I have to say that she was such a powerful influence in my life that it became the thought that I eventually just accepted and never thought of again.
His work in the physiology department, he wanted to study this with diabetic patients as opposed to normal people. And he was asking me to seek volunteers for his studies, which I gladly did.
David Jenkins has made three very distinct contributions to our understanding about the role of nutrition and food in relation to health. The first was in relation to the glycemic index, which he described in 1981. Glycemic index is a description of the way that the blood glucose rises and falls following particular types of carbohydrate foods, and has subsequently been shown to be very important in relation to helping people with diabetes to manage their glucose better.
My request to David was to tap into his unrivaled expertise in healthy diet, research methods.
If dietary fiber, which you don't absorb, actually flattens the blood glucose, and different foods have different fiber contents, then surely, even if you give the same amount of carbohydrate, it's going to behave differently. Why not let's make an index so that we can just classify foods and accept that we don't know exactly why, but classify them so that we can use them therapeutically. And that's what we did. We classified them and found there were big differences. Found that things like peas, beans and lentils were low. And the glycemic index is really just the index of the food as a percentage of the blood glucose response to a challenge of glucose.
And then the other is the portfolio diet, which was a vivid illustration that food is medicine. And essentially the leading cause of premature death in the US, Canada, and the modern world is coronary artery disease. David asked and answered the question, can we rely on nutrition to do that job? Can it be as effective as our most potent drugs? And the answer was an emphatic yes. And frankly, I think that changes everything in the house of medicine and says food is medicine too, and we could be making better use of it. And that's to David's credit.
Well, the dietary portfolio tends to be made of foods with a lower glycemic index, it's true. They were selected originally because we looked for those foods which there seemed to be good evidence that the foods, as part of a diet, lowered serum cholesterol. So people have known for quite some time now, and we've been doing work on it ourselves for many years. These sort of things are important, and they do have some dietary approaches, in many ways similar in mechanism, much more mild to what one might get with the current drugs like statin.
He certainly made me talk about food, their diet to diabetic patients in a completely different way. Now, one did that completely in collaboration with the dietitians, and they would do a lot of the detailed talking to the patients.
He's very keen that we should all eat more of the appropriate plant foods that will enable us to have better control of glucose and lower blood cholesterol. But he's also very keen because of the implications for the use of the planet and the carbon footprint of plants versus animal foods. Sometimes it seemed to be quite difficult for him to not work and do something different. But when he did, he would, for example, go wandering across the fields north of Oxford looking for Roman pottery and Roman coins and so on.
This is someone who has a lifetime of seminal contributions to the field of nutrition that has made us all better, has inspired entire lines of research. Some other luminaries owe their entire career trajectory to the work of David Jenkins and his breakthrough discoveries.
Nutrition research champion and mentor with international acclaim, Canadian Medical Hall of Fame laureate, Dr. David Jenkins.